Okay, so we're going to go with flexion PPIVMs. When we're looking at flexion PPIVMs, what we're doing is we're palpating in the interspinous space, and then we're going to move the pelvis in order to see if we can palpate separation. It's going to be different for different people based on their age and based on their prior history. When the patient's lying on the bed, remember there's going to be a tendency for the spine to side bend down towards the bed. So we can fix that by either side bending a little bit away while we do the PPIVM or put something underneath them while you do the PPIVM. Okay, so when we're doing the flexion PPIVMs, we want to make sure that we have the knees in a position and something smooth underneath so that we can move the knees. I like this part on me so that when I get the legs here, most of my work, notice I'm not grabbing or lifting anything. He's sliding. You want less friction, and then I can palpate here. So the motion is this. My hands are not gripping on hard because you want to be able to palpate. If I feel that I cannot accommodate for the side bending, I can always just go ahead and sit up for a sec. I can always just slide a towel or pillow, small pillow underneath to accommodate for that a little bit. Sometimes when you do that, your patients are happy and they'll learn to sleep like that if they have stenosis or they have issues. When you do the PPIVMs, you want to make sure you palpate, find the interspinous space. I like to kind of work my way up to know the lay of the land first. And remember, again, you don't just take your finger and put it right through. You have to take up some of that soft tissue slack so you know you're in the interspinous space. Flex till you feel maximum opening, come back. Go up to the next level. Flex and come back. And we'll get more and more flexion as we go up the lumbar spine. We're doing this because something in planar motion, opening, didn't happen in your standing test. Or when you did the modified Schrober's, it was under 5 centimeters in an older person where you think, okay, they're not opening. So this will lead to a manual therapy technique that's going to encourage opening. So when you do your PPIVMs again, take up a little bit of the soft tissue, go to where you feel it opening, and then come back. And most people, when you get here, they're like, oh, that feels great, because they live in a little bit of hyperlordosis. Good. So that's it. That's planar range of motion for flexion, a little bit of the modified Schrober's, and PPIVMs. So we're going to practice those 3 things.